Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we are going to look at the investigations, and this investigation will be for the malabsorption syndromes. So investigations under the malabsorption syndrome. So we have two kind of investigations. One will be the general test. One will be the general test and other will be the specific test. So now let's jump into the general test. So under the general test, it includes first one will be the fat malabsorption. Fat malabsorption. So under fat malabsorption, it includes the quantitative. So there is a quantitative, and this will be 24 hours fetal fat. So 24 hours fetal fat, and this is greater than 7 gram. Next will be the qualitative. The qualitative is nothing but the Sudan 3 staining. The Sudan 3 staining. Next will be the C14. This is less used. So C14 trioline breath test, as well as the fecal steatocrit. There is something known as a fecal steatocrit. Next is the carbohydrate malabsorption. We have the carbohydrate malabsorption. So carbohydrate malabsorption, what are the investigations? Investigations, it includes the D-xylulose test. So it includes the D-xylulose test. And the next test is going to be the lactose hydrogen breath test. The lactose hydrogen breath test. So this comes under the carbohydrate malabsorption. Next, moving on to the specific protein malabsorption. So in case there's a protein malabsorption, it will include the C13 egg white breath test. Egg white breath test. Next, we move on to some specific tests for the malabsorption. So specific test first will be we look at the celiac disease. So under celiac disease, there is an anti-tissue transglutaminase. So there's anti-tissue transglutaminase. So anti-tissue transglutaminase, we can also write it as the anti-TTG. Next, the celiac disease, it also includes the investigation of anti-endomysial antibodies. So there's anti-endomysial antibodies. So anti-endomysial antibodies. Next is the mucosal biopsy showing villus atrophy. Next is the mucosal biopsy. So there is mucosal biopsy and it shows villus atrophy. Villus atrophy, as well as a crypt hyperplasia. Crypt hyperplasia. The lamina propria infiltrates. The lamina propria infiltrates. And also the normal mucosal thickness. So this is under the celiac disease, the specific test, the anti-TTG. Next, we move on to the Whipple's disease. So under this Whipple disease, the mucosal biopsy showing the PAS positive. So the mucosal biopsy. So it includes the mucosal biopsy and it shows the PAS positive. And the macrophages in the lamina propria. It also includes the macrophages in the lamina propria. Now, moving on to the pancreatic insufficiency. Pancreatic insufficiency. So under this pancreatic insufficiency, there is the fecal elastase. Next, it includes the fecal chymotrypsin. Fecal chymotrypsin. Lastly, we look at SIBO. What is the SIBO? So here the SIBO, it stands for the small intestinal bacterial overgrowth. So it is nothing but the small intestinal bacterial overgrowth. So this is nothing but SIBO, and this will be due to SIBO is due to the Enterobacter or the Pseudomonas jejunal aspirate. This is due to the Enterobacter or the pseudo. So it is Enterobacter or the Pseudomonas jejunal aspirate. Jejunal aspirate. And here it is going to be 10 to the power 3 CFU. Then it is due to other organisms. If it is due to the other organisms, so here the jejunal aspirate is going to be greater than 10 to the power 5 CFU. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.